Since your SIBO diagnosis, you've developed an understanding of what it is, but still feel just as confused as you did before the diagnosis. All the discussion around which antibiotic combination to take, should you even take antibiotics, and following specific dietary modifications has left you with no more clarity than when you started. The reason you lack a better understanding of your SIBO diagnosis is because you're only aware of step 1 in a 3-step process. Let's change that. Can you remember the last time you had success completing a task when you had no understanding of what the task you were actually trying to complete was? Well, neither can anyone else. So let's take that same mindset and apply it to SIBO so you can have a better understanding and clarity on how to resolve this condition. But before we get started, allow me to introduce myself. I'm Dr. Arland Hill, and I help first-time and recurrent SIBO sufferers restore their gut function by targeting all 3 phases of the condition to resolve symptoms in a timely manner. Even before step 1 of managing SIBO, we have to talk about how you came to the diagnosis of SIBO in the first place. Would you go to a mechanic to diagnose your car problems if you thought there was just as much chance of him being wrong as right, and you would be right back in the shop again shortly after picking up your car? No, not happening. The same applies to the testing used for SIBO, specifically breath testing. It has a high rate of false positives and negatives. In other words, it could tell you you have SIBO when you don't, or that you don't have SIBO when you actually do. So if you're basing your SIBO diagnosis on testing alone, that could be contributing to your confusion. But there is a path to clarity. Remember the last piece of box store furniture that you bought that had to be put together? It came with a manual of orderly steps that would result in a piece of furniture in your home that looked just like the one at the store. Dealing with SIBO is no different. It's a series of orderly steps that will carry you past the page 1 jargon that everyone repeats, but no one really pays attention to. So let's discuss the 3 steps. Having a process creates success. Think about it as a framework, if you will. Multiple processes can work within this framework. For example, we can have different treatment regimens. They could be based on antibiotics. They could be based on botanicals, which are antimicrobial. They could be a combination of different options. And they could be different lengths of time, different dosing regimens. Many other variables could be impacted here. But the point is that within this framework, it doesn't all have to look the same, but we need a framework. And when we have this framework, it allows us to lay out a comprehensive plan that we can see from start to finish and be able to follow it effectively. And when it comes to SIBO, there's 3 steps, and we need to make sure that we're addressing all 3 steps and not getting hung up on step 1. So make changes only when necessary and not too quickly, right? We don't want to become entrapped in our protocol that we step out on in these 3 steps. We want some room for flexibility in there, but we need to understand how we're moving through that framework and getting from the beginning until the end. And if there's a need for a change in direction, well, that's okay, as long as it's well thought out. So let's talk about what these 3 phases are, and that'll give you an idea of how to effectively manage your SIBO diagnosis. So step 1, this is the antimicrobial phase. And frankly, this is what seems to be a lot of times the first and only phase for most people, the first and only step in managing SIBO for a lot of people. And when you listen to different individuals talk about SIBO, it starts to feel like, well, my protocol is better than that protocol, and if you follow this protocol, it'll give you the resolution that you want. And that's really at the core not where we need to go with this. There's the possibility that multiple protocols can work. So getting hung up on the idea of my protocol is better than that protocol is really not fruitful at the end of the day, because it's only looking at a limited part of the process. So we can make this a much more black and white movement through step 1 just by simply asking a few questions here. And so some of those questions could look like, is this a relapse? Is this the second, third, fourth time that you've been dealing with SIBO? That gives us clues and helps us understand how to navigate this. What antimicrobials have you previously used? Were they antibiotics? Were they botanicals? Did you use multiple rounds of antibiotics here and stop those, and now you're using botanicals? Were the botanicals not as effective, and now you maybe need to consider other non-botanical options and go the antibiotic route? We need to ask these key core questions to really refine what that step 1 needs to look like for you. And so here's a few others that you should think about. Did you previously use probiotics? Probiotics can be beneficial here as well. And at what part of the process did you start to take them? Are you actually dealing with SIBO? SIBO has some close relationships with Candida, intestinal methanogen overgrowth, which is known as IMO. You can click on the card on the screen here if you want to know more about that. With H. pylori, those all need to be differentiated. Are you dealing and depending on the testing to tell you when to stop treatment? Well, if you are, here's something to note is that hydrogen breath testing doesn't correlate with severity. It doesn't match up to what's going on in your GI tract after treatment. They're not correlated. Methane breath testing does correlate much better for that, but not hydrogen. And so if you're feeling like if you're dealing with excess hydrogen production and the bacteria associated with that, and you're depending on these tests, you got to change how you're approaching it. What medications do you routinely use? Are you routinely using acid blocking meds like proton pump inhibitors? Do you use opioids type medications? Maybe you got pain and you need to manage that. Have you had any type of gastric procedures like a gastric bypass? Do you have other chronic conditions, diabetes, hypothyroidism, depression? Answering these questions is going to narrow down your treatment options, and it's going to give you an idea about what the dosing and the duration should be based on what your past information and current information is. And it's also going to increase the likelihood of a more optimal treatment response, because now we're ruling out a lot of things that may not be adequate for you and may not be ideal in your circumstances. And it gives you an idea of whether or not there's the need for longer term use. Is there some unresolvable complication here? For example, I'll go back to one of the examples I use when you talk about a gastric procedure. The onset and the probability of SIBO remains high. So we want to acknowledge that and continue to keep things in place that are going to help offset that. But guys, that is everything under step 1. We haven't even begun to talk about step 2 or step 3 yet in this process. And many times the conversation doesn't go beyond where we just took it up to. So now what I want you to do is really strap in for the rest of this conversation, because this is the stuff that you need to have a big understanding on, have a really solid understanding on, because this is what's going to prevent relapse. So let's jump into step 2 here. And step 2 is going to focus on your digestive secretions and your motility in your GI tract. And so think about this as in your protocol, right? We've got our SIBO manual that we're working through. This is the middle section of your SIBO treatment manual here. So this is going to give you the most clarity, and it'll start to erase the confusion and explain to you the why. See, what's been happening up to this point is that your diagnosis has led to a temporary resolution because it's incomplete. It's simply diagnosing what the organism profile is. But it doesn't need to just do that. When you have a diagnosis of SIBO, it also needs to diagnose the cause of SIBO. It needs to answer the why. And a good history, looking at your totality of your symptoms, the collection of symptoms that you have, any testing information that you may have, but not breath testing, because again, there's a lot of limitations there. Those are what are going to guide you effectively. And you'll note that this is very similar to a series of questions that I talked about in step 1. You need the same type of series of questions when it comes to step 2. Is the issue in the stomach? Is it more of a small intestine dysfunction? Am I looking at a problem with the secretions, the acid, the enzymes, the bile? Or is this more of a motility issue? Or is there a combination of factors here that need to be thought about? And equally, diet becomes a factor in this as well. So we begin to hear oftentimes about follow this specific diet to generate a specific outcome when it comes to SIBO. But here's something I'm going to hit you with, and this should be a light bulb moment. When it comes to diet, when you have a diagnosis of SIBO, it is more about how you eat than what you eat. Let me repeat that. It is more about how you eat than what you eat. Now, I want to be clear here. I'm not saying you can go off the reservation and eat anything that you want to. You need to maintain a healthy diet. But you also don't need to get so caught up in the weeds. The things you need to be asking on this, are you eating meals? Are you eating snacks? And if you're eating snacks, you really need to refrain from those eating snacks. You need to stick to your 3 core meals per day and ask yourself, have I been fasting versus routine food consumption? Fasting over the long term here is not ideal. We want routine food consumption generally based around 3 core meals per day. So that's step 2. And after listening to this and thinking about this for yourself and knowing how you have been trying to navigate this process, if you like the idea of a thorough and guided process, guys, I want to introduce you to the SIBO Solution. It is the only comprehensive program out there that's going to turn your confusion into clarity. It's going to walk you through all 3 steps of addressing SIBO and show you how to prevent a relapse and not be that statistic where 50% of those that undergo treatment are right back in the same situation in 9 months. So you can learn more about that by clicking the link down in the description below. But let's make sure that that's not you, and let's get into what is step 3. So now we're at the last section of our SIBO treatment manual. We've got our SIBO diagnosis, and we're trying to figure out how to work through this. We've talked about step 1, step 2. Let's get into step 3 here, and this addresses the most underrated characteristic of SIBO, which is the recognition that SIBO is going to create nutrient deficiencies. Let me say this differently. If you have SIBO, you have nutrient deficiencies. Those two things go hand in hand. It is not a matter of if you have these deficiencies. It is a matter of how many of them do you have. How severe are those deficiencies? Are they borderline deficiencies? Are they overt functional deficiencies? And how much are they impacting your overall health right now? And we can break these down into different categories of the deficiencies that are most likely to be seen with SIBO. These are going to be characterized as our B vitamin deficiencies. And this is simply a byproduct of those organisms that are overgrowing in your small intestine. They are more aggressive at taking those nutrients than you are. They are getting access to those nutrients before you can, and they are stealing those nutrients and not giving you access to them. They're using them to proliferate and multiply and facilitate their own energetic needs, but you're not getting those, and that's contributing to some of your secondary symptoms associated with your SIBO. So B vitamins, definitely at the top of the list. We don't want those organisms to keep stealing these B vitamins from you, and once they have, those B vitamins aren't just going to inherently start showing back up again. We need to correct those, but we also need to create an environment in your gut where your own bacteria can start producing all of those B vitamins for you. But it's not just the B vitamins. It's also the fat-soluble vitamins. Your vitamin A, your vitamin D, your vitamin E, your vitamin K. These are going to be nutrients that literally shape the profile of the microorganisms in your gastrointestinal tract. These are highly necessary nutrients to optimize the health of your GI function. In addition, we also see another category of deficiencies here with minerals. Things like selenium, iron, zinc. These are some of the most common mineral deficiencies, but they're by no means the only mineral deficiencies that can manifest. And it's also part of the reason that we can see, for example, anemias that can start to become prevalent with SIBO. So those are more of the micronutrient deficiencies that can show up, but there's also macronutrient deficiencies that can show up. And the one that's at the top of the list here is going to be protein. We can start to see protein malabsorption. And you may be asking yourself, well, why is it so important that I address these deficiencies? We're well past the overgrowth phase and trying to get that under control. I've asked the question of why the overgrowth manifested in the first place, and I've started to do things to address that. Well, here's why you need to follow through and complete the manual and deal with step 3. If you don't do that, you're going to have a decreased rate of recovery. You're going to recover slower, not just when it comes to SIBO and your gastrointestinal health, but all facets of your health. You're going to create the wrong profile in your gut because you're not introducing adequate amounts of the right nutrients that are shaping the profile of your microbiome. You're going to have reduced energy and other secondary symptoms associated with that. And it also opens the door for a number of chronic diseases to manifest. So this is not solely about SIBO and just getting through this 3-step process just so you can check SIBO off of your list and move on. This is about your future and years to come so you can offset these chronic diseases that are often the byproduct of unrecognized, undiagnosed, and unaddressed nutrient deficiencies. You know, there's an old saying that if you fail to plan, then you should plan to fail. And addressing all 3 steps is your plan going forward for SIBO. It's not just step 1. This is going to bring clarity to your SIBO diagnosis. And now, if you want to know more about your SIBO treatment and how to shorten it, well, take a look at the video on the screen here. It's going to tell you how to go about doing that.